Hello, my name is Ewen. I have my colleagues here with me, Renel.
Hi.
All right, so we are MCPHS University student, pharmacy, um, located in Worcester. We are third year student having our rotation with Dr. Paula in the outreach, pharmacy outreach program. We can be reached on this address, 19 Foster Street, Worcester, Massachusetts, 01608. You can also contact us on 866-633-1617. In any case, if you would like to send us a fax, that would also be great. And that can also be done on 774-272-8747. Again, we are MCPHS University Pharmacy students located in Worcester. We have a very nice information for you, and this information is all about influenza virus. So we do have the question many times where patient comes asking about what is influenza. Influenza is what we have carried short as flu. So it's a viral illness or disease that causes high rate of death and often results in hospitalization. So the influenza, which is the flu, it can affect your upper respiratory tract, similar to what COVID-19 does. So when it affects your respiratory tract, it pretty much includes your nose, your throat, and radiates into your lungs. So the best way to prevent this kind of diseases or this kind of flu is to receive the flu shot, which is the influenza vaccine. And this is done annually. We are in a season whereby COVID-19 has been one of our major issues. So if we get to the flu shot season from December to February, and then you get affected with this flu, it will be hard for one to tell whether the person has contacted the flu or the COVID-19. It will take providers to do or to go to series of lab in order for them to distinguish between the flu and then the flu and the COVID-19. So it's much recommended that one would have to get the vaccine in order to avoid all this kind of mess. Why is it important to get the flu vaccine? We all know the flu is a potential serious disease that can lead to hospitalization and sometimes results in death. So thousands of people have got the flu, and the best way to get yourself out of this mess is to always get the flu shot annually, meaning yearly. The vaccination has been shown to reduce risks of illness, hospitalization, and death. In other words, it has been shown to prevent people from dying or being admitted in the hospital. How does the flu vaccine work? The vaccine is created in such a way that it protects you against the possible common virus for the upcoming season. So you as a patient will develop a protection 2 weeks after the vaccination, after you have been vaccinated or you have received the flu shot. The virus in the vaccine is inactivated, meaning they are not alive. So you cannot get the flu with the flu shot. How is the flu vaccine or the flu shot effective? So studies and research have shown that the vaccination reduces the risk of illness or diseases between 40% and 60%. Data has also shown that even if you get the flu, meaning if you get a virus ahead of time, the effects are less severe whenever you go get the vaccine. So what are the common side effects of the vaccine? One is more likely to experience soreness, redness, and swelling at where the shot was given. Headache, fever, muscle aches, nausea, fatigue are also mild side effects of the vaccine. When should you get the vaccine? it is recommended to be ready to get vaccinated early in the fall. This means that we are in the period where it is recommended for you to get it now, because the flu season starts from December to February. So you don't want to go to that far in order to get it. Anything can happen. So before the flu reaches its activity around December and February, everyone is recommended to have got it before then. So CDC recommend to get the flu shot by the end of October. What is this flu and what is new for the flu season? So we are in 2020 heading to 2021. Meaning this year we have a high dose quadrivalent Fluzone high dose vaccine, and this is available for older adults over the age of 65 years. In addition to that, we also have the fluid quadrivalent one, which comes with adjuvant and then contain extra influenza B protection. So with this fluid quadrivalent vaccine, it has 4 flu strains and it will boost your immune system in order for you to be protected against the flu. Go up for me, sir. You want to go up for me? We have a couple of myths around where a lot of people claim that the vaccine is not proven to protect the flu. But the truth is that you are at least 60% less likely to become infected with the flu whenever you get the influenza virus. Meaning when you get vaccinated or when you get a flu shot, you are at least 60% protected from getting the flu. We have also encountered many cases where people claim that the flu vaccine cannot give them the flu vaccine can give them the flu. Meaning when you get a flu shot, you are more likely to get a flu. This is never true in the sense that the flu vaccine is made up of viruses that are inactive, meaning they are not activated. So when they are introduced into your body, they cannot cause any infection. Rather, they make your immune system get used to the virus. So whenever you go in contact with anybody who has the virus, your immune system has already experienced the same virus that was in the vaccine. So they can fight it earlier. Within 2 weeks, they get immune and they can fight. Some people also claim that they will wait to get the vaccinate. They will wait to be vaccinated and be covered until the end of the season. This is not advisable in the sense that when you get yourself vaccinated earlier or as soon as possible, it will take 2 weeks for your antibodies to develop to be immune against the virus. So the earlier, the better. People also claim that the flu shot will protect them from every type of flu virus. Yes, it is true that the flu shot is really effective and then it protects you from the flu in a very high level or any high risk. But this is done yearly. So in the sense that the flu vaccine is made in such a way that they target the strains of the virus that will circulate within every year. So with every year, you have to get a very new flu shot in order to protect you from the virus that might arise in that particular year. I've never get the flu and I don't need the flu, which a lot of patients come to the pharmacy says that. Yes, it is true. Some people don't get a vaccine, but they are okay. But who knows? Maybe for this year or for next year or the following year, you might get a shot, you might get a flu, and then by so doing, you go ahead and infect all your family members. So it is more advisable to get the flu vaccine in order to protect yourself and also protect others who are more close to you. And this all the information we have for you containing in terms of the influenza virus. If you have any question, please don't hesitate to contact us. Once again, my name is Ewen, and I have my colleagues here with me, Renel. Thank you.
Thank you.
You're welcome.